today's interview feature is called W Talk, where we delve into thought-provoking topics that matter to women. And on today's show, we'll be talking about blood donation and iron deficiency. And to help us understand this topic a little better, I have in the studio as our special guest, Dr. Christina Lee Lai Ling. She's the head of Department of Transfusion Medicine at University Malaya Medical Center. Dr. Christina, good morning and welcome to W Talk.
Hello, Anil. Good morning. Yeah, thank you for having me here. Yeah,
the pleasure is ours. And I understand this is not your first time on Trax. You've been a regular on our show.
Yeah.
Thank you very much for taking time off.
Thank you for inviting me. Yeah.
And also for our listeners, don't forget that you can also catch the interview via TRAXXfm's official YouTube channel. There you can get a glimpse of what's happening in the studios and take a look at our guests as well. Now, Doctor, without further ado, we'll jump in straight into our discussion today, which is, I should say, it's Iron Talk. We're talking about donor essentials. Right? Yes. So, Dr. Christina, if someone is looking to donate blood here in Malaysia, what's the ballpark hemoglobin level that they should aim for?
Okay, thanks, Anil. So, in Malaysia, the minimum hemoglobin that a person can donate blood for men, it will be 13.5 gram per deciliter, and for women, it will be 12.5 gram per deciliter. So, this is the minimum hemoglobin for a person to show that their blood, in their blood, the hemoglobin is good enough for them to donate to another person. Because in blood donation, we typically do not take anything more than 13% of the total blood volume from a person. So, example, it based on the weight of the blood donor as well. Sometimes we have a smaller, more petite female donors, so we will take less blood from them to not cause them to have any iron depletion or any effects of iron deficiency in the future. Yes.
So, speaking about low hemoglobin levels among blood donors, what do you think is the major suspect that's causing the depletion in the hemoglobin levels?
Yeah, thanks, Anil. So typically when a person wants to donate blood, which is very good because blood donation is actually an altruism act. So the first thing we need to know is we do a capillary blood check on the fingertip to see how much is the hemoglobin. Now, we used to think that this just check your capillary blood on the fingertip is very accurate, but actually it is not so. Actually, it just reflects the hemoglobin is good enough to donate blood, but it doesn't show what is our storage iron. So typically, I like to think about our iron as a functional iron. Usually, our iron, we put that in the iron in our body. Most of them are functional. About 50% to 55% of them is in the function where you can see from your blood test, and another 40% is actually in our storage. So what we check on our blood is like our cash. If you have enough cash, you can go out and buy things.
It's like money that's left. When you run out of money, that's when you start getting worried.
Yes. So the one that we are always concerned about is actually the iron storage, which is actually about 40% of our iron is actually stored in our storage pool. So we can only test this with actually more blood tests, biochemistry tests, such as the serum ferritin. So coming back to in a blood donation setting where we just check a capillary blood, typically a low hemoglobin in a blood donor, less than 12.5, we do not allow them to donate blood. Now, what could be the common reasons? Most of the time, if let's say this is a female blood donor, we usually think about physiological cause first. Is it just have a menstrual blood loss and is it too much menses? Or sometimes our diet is not good enough. We are not taking iron-rich food. Or what is the diet? Sometimes vegetarian, I'm not saying all vegetarians, but many studies have shown that vegetarians is more increased risk of iron depletion. The other thing is sometimes we do have donors who donate very, very frequent, and yet they do not compensate their iron loss from blood donation. That can also cause iron depletion. At the same time, Malaysia, we are actually in the Mediterranean belt, and thalassemia can be quite common. But thanks to our nationwide thalassemia screening program, we can already identify a thalassemia carrier or so by the time they become an adult as a potential blood donors. So sometimes thalassemia patients, they can also have very low hemoglobin that is not suitable to donate blood.
Right.
Yeah.
Now, I came across a study that said that regular blood donation can lead towards a reduction of hemoglobin levels in our bodies. Now, I want to sort of, dissect this and focus it on women. moving away from blood donation, now, women experience something called menstruation every month.
Yes.
Due to heavy menstruation, especially when they're reaching their 40s menopause level, when they're experiencing that, will that also affect? Can you share your thoughts on how that affects the iron
loss?
Iron loss,
Yeah,
yes.
sure, Anil. So what we typically see in the lifespan of a woman, so by the time you are 17, you can start donating blood because there's a legal age of donating blood. So women, typically they will donate, the female and male ratio of blood donors are typically quite the same during the 20 to 30s. And by 30s, a lot of women go through childbearing age. That's when, blood loss from childbearing and also pregnancy, breastfeeding, so they would be differ. So that we can see the percentage of female donors coming down in the childbearing age. Then, as a woman going into menopausal age, post-childbearing, they have a good time of no more childbearing age. So that is then the iron stores are slowly compensated. And as if some of them have very irregular menstrual bleed and things like that, they can have iron depletion as well as they go into the perimenopausal stage. So what we typically see is in a childbearing age group women, because of menstrual loss and also the childbearing and all these natural processes, there is less blood donors during this age group. And during this age group as well, because the iron store is much more needed. In average, a man will need approximately about 6.7 milligram iron, and a women need about 11.4 because women regularly lost blood.
That's like 3 times more than what men need.
Yes, but when we talk about blood donation, a woman and men, if they are of 55 kilogram, they are donating the same amount of blood, right? So as you can see, the same amount of blood in the whole blood, you will also lose iron. So if we were to do a head-to-head comparison, for example, if a woman donates 450 ml for blood donation, in this donated blood, it contains 225 milligrams of iron. It's about 10% of her iron store. Whereas for a man, if he were to donate 450 ml of blood donation, it also contains 225 milligrams of iron. It is only 5.5% of his total iron store.
Okay.
So it is already not equivalent. Therefore, actually, on the blood bank setting, we do not really encourage women to donate as regular as men. Certain countries like India, virtually most of the donors, you can see a very high percentage of male donor, simply because also in this India's background, many are vegetarian.
Right.
So vegetarian diet and predisposed to also the women, also all these physiological factors, the women hemoglobin are much lesser.
So consuming a vegetarian diet promotes the replenishment of blood in our system. Is that fair to say that?
So for vegetarian diet, there is actually two different school of thoughts. Some vegetarians would think that I will just get my iron from iron-rich food. There is a lot of iron-rich food, for example, spinach, legumes, beans, and etc. Tofu and things, dal, dal. These are very high in iron food. But coming back to the biochemistry, actually the meat-based food, actually the iron is easier to absorb. For example, liver or red meat, the iron content is much higher in this non-vegetarian food source, and it's also easier to absorb by our gut. So therefore, there are two schools of thought. Some vegetarian will complement their diet with iron supplements and some do not. So that really depends. But I strongly urge to get the iron study checked regularly if you intend to start a vegetarian
diet.
Yeah.
Okay. Now my next question, Doctor, I'm going to break it down to 2 parts. I'm going to I want to touch on what do we do to enhance the iron content in our body. And then I will talk about how do we instantly sort of replenish the iron that we supposedly would have lost after donating blood. So, because I'm sure our listeners would be wondering right now, right? So if I donate blood according to the amount that Dr. Christina just mentioned, how do I instantly, once I step out of the blood donation campaign, what do I first have to consume so that my body is able to start replenishing the iron that it has lost? Your thoughts, Doctor?
All right. So typically after we donate 1 unit of whole blood, like in Malaysia's setting, we have 350 mils or 450 mils. Our body take an average of 70 to 150 days to compensate all this iron loss. Therefore, you cannot donate a whole blood very regularly. You can only do it after 90 days or so. So immediately after, and we are very blessed because in Malaysia, most of our blood donation center, after blood donation, we give out iron supplement and folic acid to our blood donors. However, this is not the full dose. You probably need more than that. Typically, we give like 1 or 2 weeks to the blood donor. But it's quite sad sometimes sometimes our blood donor may feel, oh, I don't need it because I'm a healthy blood donor. But what we do not think about is actually the iron that we lost during the blood donation.
Okay.
So to compensate iron loss, I typically to encourage all our blood donors, especially women, to take the iron tablets, iron supplements, or folic acid together after the blood donation, and also to take more iron-rich food.
Okay.
Yes.
Okay. Great. Folic acid and iron supplements.
Yeah.
All right. Dr. Christina, thank you very much for sharing your thoughts. We'll go in for a quick break. When we come back, we'll try to find out more on how iron gets absorbed into our system. Yeah?
Sure.
For our listeners who are just tuning in, I'm speaking to Dr. Christina Lee Lai Ling. She's the head of Department of Transfusion Medicine at University Malaya Medical Center. And today we're speaking about blood donation and iron deficiency in women. Keep it right here on W Talk at Trax Momentum. Welcome back to W Talk on Trax Momentum. I'm Anil on the mic, and today I'm speaking to Dr. Christina Lee Lai Ling, the head of Department of Transfusion Medicine at University Malaya Medical Center. And today's topic is on iron. Not iron, the raw mineral, but iron, the nutrition that is needed in our body. Dr. Christina, welcome back to W Talk.
Thank you, Anil.
All right. Now, Doctor, we're going to break it down. Now, how exactly is iron absorbed in our body? And how vital is this nutrition of iron for women especially?
Yeah, all right. So, well, this is always our exam questions during our medical school.
Really?
And
Okay.
it's so
So
complicated.
you have it at the back of your head?
Yeah, okay. So I'll try to simplify
Yes,
it.
yes.
Well, iron is a vital element in all of us, right? So it is very important to, iron is part of to create new red blood cell, carry oxygen around our bodies, and also part of our immune system as well. And you'll be surprised, actually, most of our iron in our body, 50 to 55% of them are actually in our red blood cell, what we call a functional iron. So they are sitting there in all our red blood cells. So if we lose blood, and our iron will also be lost in our blood. And another 40% sits in our storage iron. They sit in our liver and also our macrophage. And these are our storage, like our fixed deposit. So the cash is actually in our red blood cell, hemoglobin. And the rest, they are circulating around our body. They can be in our bone marrow, or they are just circulating and carried by the proteins. Now, we usually get our iron from two main sources. 5% only comes from our diet, actually. It's not all our iron comes from our diet, and 95% are actually recycled from the red blood cell. You know, our red blood cell, actually, we make new red blood cell, and our red blood cell break down every day. So all this breakdown of red blood cell, they're actually, the iron is actually recycled to be used in the functional iron part. And typically from our diet, the iron is actually absorbed in our gut. So once we eat an iron-rich food, the iron will be absorbed in our gut, and iron actually exists in two forms. The Fe2 plus, like, biochemistry, they call the ferrous form, and also the Fe3 plus, the ferric, which is the rustiness. Okay, so the Fe2 plus is actually acid soluble, so they go into our stomach and they can be absorbed in our duodenum, in our guts. Now, once it's absorbed, it can be stored as a ferritin, and it's bound to the proteins and transport to a bone marrow to make new red blood cell. So the process begins. And at the same time, we also have this control protein, the hepcidin. Actually, this hepcidin, they will be there to regulate, because we don't want too much iron. We can have iron overload. And we also don't want too much, too little iron. So they are there monitoring how's our iron stored in the whole body, whether we should absorb more or absorb less.
So you talk about, sorry doctor, you talk about red blood cells. As I know, red blood cells are essential to bring oxygen to the body.
Yes.
So is that why maybe people who lack iron in their body have shortness of breath?
Yes,
and
you are
like
right, Anil. Yes, you are right. Therefore, because when iron is deficient, that's the final stage of iron deficient anemia, you can see all the signs and symptoms. For example, you look pale and you are very weak, very tired, because there's not enough iron in your hemoglobin to carry the oxygen to refresh us. So a patient can be easily tired, and the nails and the hair are brittle and not shiny. And at the same time, sometimes you can have difficulty in breathing because of lack of oxygen and things like that. And interestingly, a lot of people like to eat ice. Ice craving can be one of the sign of iron deficient. So typically the stage actually at first we have iron sufficient, right? Any normal person, iron sufficient. Then you will go to iron depletion. Iron depletion, but you still have a normal hemoglobin. That means the storage, the fixed deposit is actually affected, but the cash bank is still adequate for our day-to-day usage.
Right.
Then it will go down to iron deficient, and finally iron deficiency anemia, where the fixed deposit is gone and also the cash is also gone. So the hemoglobin will tell very low hemoglobin, and at the same time the ferritin, the storage iron, the fixed deposit is also very low. So it goes this stage.
Okay, doctor, could you give us an in-depth explanation on some of the telltale signs that we can slowly start seeing when our body experiences a deficit in iron? What are the things that we can look out for, and it maybe ring a bell and say, oh, I'm experiencing this, or maybe I am experiencing iron deficiency?
So so like I was sharing, it has actually 4 stages typically.
Okay.
So sometimes when it is iron deficient, iron sufficient, you don't have any sign, you are just a normal person. But when you are going into this iron depletion, it's very you don't really have any telltale sign. Because mostly you just feel normal. It's just probably a bit tired. You may think that you have a busy schedule. Typically, it is only until the iron deficiency anemia stage where you can see all this full-blown pale tiredness, your hemoglobin drop, bitter nail, and things like that. But I would encourage most of our blood donors, they are very actually conscious about, what's my hemoglobin today? Can I donate blood? Yeah. So if you start to feel sometimes, especially sometimes blood loss, hemorrhoid or parectal bleeding, sometimes this is something very private. We dare not to tell anybody, you know.
Yeah.
So we should seek medical treatment, get our blood test done, and see whether we are slowly losing our blood and also our iron from the blood.
Which is oftentimes an overlooked aspect of our well-being, to get our lab work done for our bloods as well.
Yes.
How often should one go for regular blood analysis, doctor?
Okay, so typically in Malaysia, once a pregnant woman is booked, when they are confirmed to be pregnant, usually we'll do a full blood count to know what is a hemoglobin level and things like that. Typically, we do not do the iron study until we are suspecting maybe this could be iron depletion or etc. So for anybody after 40, women after 40, I would encourage a yearly medical checkup, including pap smear, breast examination, and the rest. Women health, women wellness. But for blood, some of us have blood fear, needle fear. We still need to see a lot of things from our blood.
Yeah.
We need to analyze using a hemoglobin analyzer and also a biochemistry analyzer. So we still need to get our blood tested to know all this.
Okay.
Yeah.
So the best would be at least bare minimum once a year.
Yeah, once a year. If all is fine, maybe in 3 years later or 5 years later. Yeah.
Okay. Now let's get a picture of the situation on ground in Malaysia right now, doctor. How common is iron depletion among blood donors in our country?
Okay, right. Iron deficiency or even anemia is actually a global problem. So one is actually, so we are not also spared because iron deficiency is very common. We have multiple studies done in Malaysia. Like for UMMC study, we had a study done in year 2002 and also year 2005. Actually, it depends. About 5 to 20% of our female regular blood donors, they could be iron depletion. So especially female regular blood donor, meaning to say they donate blood more than twice per year. Most of the time, first-time blood donor, they are still well, the iron store is good and things like that. But if they donate more regularly, more than twice per year, then they are more prone to iron deficient. Sometimes we think that male donors are okay. Male will not have this iron depletion problem. That is also not true. We also find about a small percentage, not as common as female, a small percentage of our male donors, our male regular blood donors could be also iron depletion.
Wow. Okay. And how do we treat that iron deficiency, anemia among blood donors?
All right. So typically, once by the screening, by the capillary blood test, we know that they do not pass the pre-donation hemoglobin, then we will not allow them to donate. So we will, because from our hemoglobinometer, we can agak-agak know what is the level. Okay, let's say less than 10, and we will ask them to see our medical officer whether they have any blood loss, recent illness, or things like that, which can contribute to any loss. But if the very borderline case, we will advise them for high iron diet. So I just want to highlight to all our audience here, having cereal and coffee tea is a bad combination because tea and coffee inhibit iron absorption. I myself love cereals with coffee in the morning, especially black coffee. But
tea and coffee inhibits iron?
Yes,
wow.
yes, because they contain certain substances that inhibit the iron absorption. However, if you take like vitamin C rich fruits, fruits with iron rich food, it is increasing your absorption. So typically, apart from taking iron supplements, we need to increase our vitamin C intake.
So consuming iron is one, but at the same time, our body's having the ability to absorb that iron is also another crucial aspect.
And
wow. How do we strike a balance with that, doctor?
So typically, we think of cereal because cereals actually contain certain substances that will inhibit the iron absorption. But like a typical red meat meal with alcohol or wine, actually they is actually encourage encourage absorption of iron.
Okay.
So red meat with red wine is actually a good combination.
Okay. Okay. We'll spare the wine for the conversation. Focus on the meat. But anyway, we'll go in for a quick break, doctor. When we come back, we will talk about how we can increase iron storage in our body here on W Talk. For all our listeners who just tuned in, I'm today speaking to Dr. Christina Lee Lai Ling. She's the head of Department of Transfusion Medicine at University Malaya Medical Center. And today on W Talk, we're talking about blood donation and iron deficiency. We'll be right back after a quick break. Keep it right here. Absolutely, TRAXXfm, your favorite station. We're back on air again on today's edition of W Talk here on Trax Momentum. I'm your host, Anil on the mic, and today I'm speaking to Dr. Christina Lee Lai Ling. She's the head of Department of Transfusion Medicine at University Malaya Medical Center. Dr. Christina, welcome back to W Talk.
Thank you, Anil.
Now, the golden question: how do we increase iron in our bodies?
Yeah, this is one of the frequently asked questions. Yeah, so I think specifically for women, once we donate blood, I wouldn't encourage women to donate blood every 3 or 4 monthly, because we are our iron store and our iron loss is not like the same as a man. So for women, I would encourage us to space out your blood donation, right? And you do not have to donate a big bag. Sometimes we have 350 mils or 450 mils. Maybe you can choose to donate a smaller bag to reduce your iron loss during blood donation. And post-donation, typically we give our blood donors a supplement of iron supplement. Please complete it. Typically, our blood donors will just take 1 or 2 days. Okay, I'm fine, because there's no sign and symptoms for early iron loss.
Should women refrain from donating blood when they're menstruating?
Yes. All right. Usually, typically, 3 days during the first 3 days of menstruation, women should not donate blood.
Okay.
But after that, after day 3, they are allowed to donate blood.
Right.
Yeah.
Okay.
So there are a lot of food which is rich in iron. Okay. So for the vegetable source, spinach is number 1. I think all of us know about Popeye, the movie,
Popeye,
right?
The Sailor Man.
Yeah, the Sailor Man. So spinach is very, very good and very high in iron. However, you do have to take a lot of spinach. So the iron content is quite equivalent to a tablet of iron tablets. And potatoes, cereals, tofu, dals, lentils, they are also very high in iron. Almond as well.
What about moringa, doctor?
Yeah, moringa as well. So these are very good source of iron from food, vegetables, raisin, dates, and things like that. But if we were to compare for iron-rich food in the meat, that's definitely much higher. One of the highest will be liver and red meat, and also cockles, kerang. In our kway teow. Yeah, cockles is one of that. So sambal, kerang sambal is actually one of the good source of iron. Chicken, fish, not so much as compared to red meat. So these are eggs also has a quite good source of iron. So these are all very typical food that we eat day in and day out. Okay. So and another reminder to all our listeners here: if you are taking cereals for breakfast, try not to mix with coffee or tea. Perhaps you should do it after 1 or 2 hours after the cereals, because it blocks your iron absorption.
So just perhaps cereals with milk would do.
Cereals with milk. Then maybe if we need our coffee, we go for it later.
So it's not completely refraining away from coffee. It's just that when you're having your breakfast, don't mix it up with coffee. An hour later, as you said.
Yes. And taking citrus, vitamin C rich food can also encourage the iron absorption.
Okay. Now, doctor, I want to go back a little bit to blood donation. Right? Because I was doing some research before having this conversation with you, and I read somewhere that our body loses about 200 to 250 milligrams of iron every time we donate blood. When we roll up our sleeves, is this the same for women and men?
Okay.
Or is this a myth that women are the ones who end up losing more iron compared to men?
Okay. So if we were to calculate by the volume that we lose, if I were to compare just head-to-head comparison, a woman donate 450 mils of whole blood, a man also donate 450 mils of whole blood. However, we must know that the total blood volume is higher than a woman. So if our total blood volume is higher, we will naturally have higher in iron.
Okay.
So this same amount of product that is out from the body, both this from the female donor, it will have 225 milligram of iron, and from the man is also 225 gram of iron. Right? In terms of iron, they are all same in the product, the end product. However, from the women, this is 10% of her total iron store.
Wow.
And from the man is about 5% only from his total iron store.
Why does that happen for women?
Because of the total blood volume. The more blood we have, the higher iron that we have. And not forgetting that after a woman leaves the donation center, she will have a menstrual bleed as well. And men also have the androgen hormones, the male hormone. These male hormones are going to encourage erythropoietin production. Erythropoietin will encourage iron absorption as well.
EPO.
Yes. So these are synergistic, in fact, for a male.
Right.
But whereas for a female, they're going to lose blood again from menstrual loss. So therefore, a female will lose more iron in blood donation compared to a man, and particularly in a female regular blood donor.
Right.
Yeah, not a first time, because first time is like they they are starting point
Yeah,
the same. Yeah.
So maybe this goes to show that men should be donating more blood
Yeah.
compared to women. Spare the women.
Yeah.
Which leads me to my next question, Doctor. It's a W talk. We want to inspire people out
Yeah.
there. We also want to send out a message of positivity. Talking about blood donation. From your perspective, Doctor, how important is it to donate blood? And why should we be doing it, Doctor?
Yes. Well, blood donation is actually blood is actually a natural, finite, and precious resource. So we cannot for now we cannot actually make blood from. Yes, there are a lot of people doing trying on research level trying to produce red blood cell from stem cell and things like that. There are many ongoing trials and studies. But for now, for the blood for transfusion to help another person, it is mostly sourced from blood donors. So donating blood is actually an act of altruism. So we donate to help others without any compensation. In Malaysia, donating blood is voluntary and we do not pay our blood donors. Therefore, it is actually an act of altruism, a heroic act. You can be a hero,
Yes.
You don't have to be a doctor to save life, but you can be a blood donor. Because the blood that we donated, we keep in the blood bank, there will be some patients, whether having blood loss or a dengue patient needing the platelet or a bleeding patient needing the plasma. Eventually, the blood will be used for somebody. So it's actually a very altruistic act.
Okay.
So, and also in Malaysia, our blood donor rate is still very low. We are about 2.5% currently, as compared to other countries where 8% of the population could be a blood donor. As we face with the aging population, we know the sick and the old and the extreme age group, they might need more blood for transfusion.
Yeah.
So we are having this healthy population, 17 to 60, the healthy population, to support this aging population, right? So definitely blood, if we can, we should be a blood donor. It should be a privilege, but it's not a priority. If we are healthy enough to help others, we should become a blood donor. But for female, for women, especially for this channel, yes, we can become blood donor, but we space out our donation, and finish all our iron supplements and take iron-rich food after the donation.
Okay.
Yeah.
Men can be heroes all the time, but
Yes,
women have to
yes.
space out. Heroic
Take your
acts.
time. Yeah.
And I really like, this is what I love about these conversations, because, you get sparks of moments where something just lights up, because you mentioned that blood is finite.
Yes,
it's a finite natural resource. It's, it's like, not like, and it's a natural resource that is something new to us. But now we know that it's finite. It's very precious.
Yes.
And it's something that it's within our bodies itself, right?
Yes.
And we can do our part to help another person.
Definitely.
Right? Great.
Yeah.
Any parting words before I let you go for this show?
All right.
Christina?
Okay. To all our listeners here, thank you for listening. And especially now that we are in a Christmas season, end of the year, there will be a lot of people traveling and things like that. And naturally, our blood donation rates will come down. So I pledge all of you, if you're healthy and well, and of course, women have a very good iron store. Please come forward to donate blood in any of our nearest blood bank. You can donate blood, for example, here in Kuala Lumpur. We are UMMC. We are also a donation center, or also National Blood Center or Hospital Klang. Please donate and save life. Because typically blood banks during this holiday season, balik kampung phenomena, we tend to experience a drop in donation rate.
Right.
However, our patients are still coming in. We are still 24 hours open for service.
Okay.
Thank you very much.
Great. Thank you very much, Dr. Christina, for spending your time this morning. We look forward to having you in the studios again. Thank you. Take care.
Thanks, Anu.
All right, and that was Dr. Christina Lee Lai Ling. She is the head of Department of Transfusion Medicine at University Malaya Medical Center. And today we spoke about the blood donation and iron deficiency status in our country. Coming up in less than 10 minutes, we'll be crossing over to the RTM News Center for the 12 o'clock news updates. And then right after that, I'll be back for the third hour of Trax Momentum. Keep it right here. Stay tuned.